Thank you. So, I'll just tell you a small story. In 1994, when I was still a resident at AIIMS, one of our doctor colleagues got bad bone marrow cancer and needed a bone marrow transplant. It was not done in India at that time. And we all contributed some money. He was a good middle class fellow, but he could not afford 25 lakh rupees. That was the cost to go to USA. Many of us contributed. Unfortunately, he went and he died. He didn't make it. Today in Max Healthcare, we routinely do bone marrow transplant for 6 to 8 lakhs. Now you might argue that this has become more affordable, or you might argue that for a person who's earning 50,000 rupees a year, this is hugely expensive. It's the same price point. So the real question is, what do you mean by affordable healthcare and for whom? I would argue that each one of us in this room probably can't afford a 10 lakh rupee surgery off the cuff. Not many people in India can, probably even I can't. So there is a case, while we talk about the 100 crore, there is a case to talk about the 2 crore or the 1 crore as well. And I think that's not to be lost sight of. That's the first point. The second point is a more disruptive one, which I want to address both to my industry as well as to the device industry, which is that if we follow the path which has been followed in the Western world, we will end up where they have ended up, which is crying hoarse about cost. US spends 20% of its GDP on healthcare and has pretty bad outcomes. And we don't want to get there. And the path we are following today will get us there. So you actually probably have the wrong set of people on this panel. The right guys are the e-health points and the one breaths. Those are the guys who will be disruptive, who will create a new business model for delivery and a new device which is created in a completely different way, innovated from bottoms up for India and for the masses. So that's the way we think about healthcare. Now, are we going to get out of tertiary care and quaternary care and stop doing transplants? No, there's still a need for that. And there is a need for high end, because in the absence of high end, the low end doesn't matter. If every middle class person thinks that for a bypass surgery they have to go to Houston, we will feel ashamed to be Indians anymore. It used to be the case in the 1980s when it was almost glamorous to get a flight to Houston and get a bypass done from there. Mm-hmm. So we have progressed a lot in terms of affordable healthcare delivery, but the thought I want to leave this audience with, and I'm assuming there are many innovators, entrepreneurs sitting in the audience, is that don't just look at Max and Philips and GE and Apollo and say this is what India is going to be. India has a unique opportunity to leapfrog over all these existing models. You have 900 million cell phones. You have banks and financial services players going deep into the base of the pyramid. Healthcare has not reached there yet. The government has not managed to reach there despite the duty or thing that we hope it takes. So there is an open field for us to innovate upon, and that's what we should all work towards. In Max Healthcare, we are working towards that, but being a legacy player, if you will, it's harder for us to do that. Being an e-health point, it's easier for them to do that, although they have their own sets of challenges to face. So it's not easy, but it's very exciting, and I would invite all of you to that journey.
No, that's terrific. I think what you're saying out here, Ajay, is that it's an and, not an or, and there are ways in which to expand your reach, which are mutually beneficial to everyone, most of all to the populations that we're serving. So it plays both ways. Rekha, from your perspective, affordability, what does it mean? A device manufacturer like Vijay Sima and One Breath sitting to your right, what does that mean?
So I think Ajay captured it very well. They have the dual challenge of serving both, their patients in a setup like Max in Saket, where you have high-end, affordable and affluent population of patients who are coming, who expect the best in technology. So we, because we are serving them, we have the challenge of making sure that we have that high-end technology available in India, so that patients don't need to go outside of India to get the care. So if you want to get a digital MRI done here, you can go to a Fortis Gurgaon or a Max Healthcare and get that done. So we want to make sure that we are catering to that population. At the same time, we recognize that players like Vatsalya or nursing home players or smaller players who are in tier 2, tier 3 towns don't want to spend as much on medical equipment. So what we are doing